Usually 10% is a small number. When you start with 15 million people, you're talking about 1.5 to 2 million people. So those individuals, even though they are treated with levothyroxine, they don't feel well. They just feel, some of the symptoms that they had when they were hypothyroid remain. They're just there. Their patients, they complain they have difficulty losing weight. They are unfocused, and they have low energy. And this is sort of interesting because these three symptoms are so common. I mean, you don't have to have hypothyroidism to have this same symptom, right? I mean, the difficulty losing weight, I'm tired at the end of the day, and I can't focus. In general, over the last 30 to 40 years, these symptoms have been a little bit dismissed by the physicians. You know, what do the physicians look when they treat someone with hypothyroidism? They look at the TSH serum levels. If the TSH is high, you have to increase the dose of levothyroxine. If TSH is low, you have to reduce the dose of levothyroxine. And that's how the guidelines tell us how to treat patients with hypothyroidism. Obviously, the goal is to make the patient feel better, but how do you do that? You have to normalize serum levels of TSH. So it turns out that this 10%, 15% of the patients, they have normal TSH, but they still remain symptomatic. And you know, doctors will say, well, your TSH is normal. Your levels of thyroid hormone are normal. You're taking the medication correctly. You know, I mean, you should be feeling normal. Then the patient is unhappy with that response. Patient goes to another doctor, then goes to another doctor, and goes to another doctor. And those patients get very frustrated. That's the type of patient that I decided that I wanted to understand this a little bit better, because it has to do with thyroid hormone action. It has to do with how thyroid hormone regulates basically gene expression in different tissues. To approach this problem, the first thing is it real or it's not real? Do these patients have symptoms or they don't? I mean, because you know, how do we figure that out? And if you look at population in my office, it's going to be completely biased, because the patients will come to my office because they understand I work with that type of patient. So we wanted to approach this in a way that is completely unbiased, in a way that, you know, we start from a very clean slate. And so what we did is we looked at the NHANES study. You know, NHANES is a national study where individuals that are not patients are randomly selected to be participants in this study. And so it's fantastic because the data is publicly available. You can just go online and download it. So we looked at about 10,000 people that are participants in the NHANES study. And out of these 10,000 people, they're not 10,000 patients. They're just 10,000 Americans that were randomly selected across the country. We looked at how many were taking levothyroxine. And in fact, we found about 480 patients, which is pretty much the same incidence of hypothyroidism in the population. It's about 4.5%, 5%, right? So, and then what we did was we had this population of 480 individuals on levothyroxine. Out of those 10,000, we also created a perfectly matched population to compare with this 480 patients on levothyroxine. And we matched those individuals by sex, we matched them by ethnic background, and we matched them by TSH levels. So that was the critical point here. We want to make sure that both groups had the very same TSH levels, the treated with levothyroxine and the non-treated with levothyroxine. And when we compare them, and again, this is a study that was not designed to look at thyroid symptoms. This is a study that looks at everything, hundreds of questions and tests. We saw that the patients on levothyroxine weigh about 10 pounds more. than the patients that are not on levothyroxine. They have the same level of TSH. Second thing, those individuals, well, you might say, well, maybe they eat more. No, in fact, they eat a little bit less than the patients that are not on levothyroxine. So when the patient comes to me and say, I have difficulty losing weight, I mean, I have to believe it, because this is what study is showing me. Number two, they were more likely to be on antidepressive. Wow, that's amazing, because that's what the patients tell me. They don't feel well, they feel depressed, right? They were more likely to be on statin. Why would that be? Well, because their cholesterol levels are higher. And they were more likely to be on propranolol or on beta blockers, not propranolol, any type of beta blocker. That was, for me, it's surprising. I did not expect that. We're trying to understand why that is. But at face value, I would think, well, this individuals probably they have higher blood pressure, because if it were prescribed a beta blocker.